Hello everybody, and I'm sorry I can't be with you at today's event, but following a chat with Cliff, I asked if I could say a few words about health and wellbeing in Halton. So here goes. Improving health and wellbeing in Halton is our #1 priority. It's a real tough nut to crack, and we do start from a low base. For too many years now, our population have been making poor lifestyle choices, and that's caused them problems with their health, especially as they've got older. So part of what we want to do, and what we're working with all our partners to do, is to try and help our communities make different choices. But it's not just about their choices around smoking, their choices around alcohol, their choices around diet, and their choices around exercise. They've all contributed to ill health in Halton, but so has poverty. Over a quarter of our children in Halton live in poverty, and that limits people's choices about what they might do to ensure that their health and well-being is better than it is now. So the solutions are not just clinical solutions, it's a whole system solution that we're trying to work on here in Halton. The challenge is huge. Our statistics for health don't look very good, and they're not anything to be proud of. But it's not all doom and gloom. There's some really good work being going on over recent years, and we have seen improvements in life expectancy. Smoking has reduced, alcohol harm-related illness has also reduced, our cancer rates are falling, and we're reducing the health inequality between our very wealthy areas and our poorer areas. So that's all good news and down to a lot of hard work by a lot of people. So what do we need to do different? I think what we need to do different is make a step change. Incremental improvements are great and they're very important, but we need a step change if we're going to make a really big dent in those statistics that I mentioned earlier. It's everybody's job. It's not just the doctor's job, it's not just the public health people's job, it's everybody's job. And the people who also need to sign up are our local residents. As I said earlier, they've been making poor choices, but we need to help them. We need to create an environment where they can make different choices. So if they want to get to a GP surgery locally, we need to make those surgeries available to them. If they want to go to a walk-in centre or an urgent care centre, they need to be available locally, and they need to be available and accessible when they want them. So we have a big responsibility to help people make better choices, and a lot of people are working hard on that at the moment. I personally believe, and I know others do, that we have a real opportunity in Halton at the present time to make that step change in health in Halton. And there are a number of players that are all making very strong efforts to try and improve how health and well-being is delivered within Halton. Our CCG is innovative, it's creative, it's committed, it's well led, and if you've taken the opportunity to read their 5-year plan, it's an impressive document. Their relationship with the council, both officers and members, is really strong, but also their relationship with children and young people services, with adult social care, and also with public health are all really important. And that's helped. It's a really powerful partnership, but it's helped by co-location. All these people are based together, so they see each other on a day-to-day basis, and they can explore and develop new ways, new ideas to try and improve the health and well-being of people in Halton. But also pooled budgets and a shared philosophy are making a really big difference to how health is being viewed in Halton. And we're also looking at evidence-based activity. We want to spend our limited resources wisely, and to do that we need to look at the evidence and focus our money where it makes the biggest difference to our communities. It's also good to know that in Halton all our providers, whether that's Bridgewater, our community providers, our 2 hospitals, or 5 boroughs, our mental health providers, they're all signed up to this agenda, and I think that's a really powerful statement about how our providers think health in Halton can develop. The voluntary community faith sector also have a really important role to play, and I'm very excited about the new forum that we're about to create with voluntary community faith sector colleagues, looking at how we can do business differently in our neighbourhoods and our communities, and I think that can make a very big difference around health. Public Health are also doing their bit. They're running lots of different programmes. They're helping educate people. They're helping people to make different decisions about the way they eat, the way they drink, the way they live their lives. And they're also delivering a number of opportunities to encourage people to present early, because we know if people present early, we've got a better chance of helping them get better if they're not very well. Our GPs also are looking to do things differently and develop new ways of working. In particular, right care, the right time, the right place, whether that's in a GP surgery or in an urgent care centre. We're trying to make it easier for people to access health services locally and in a timely manner, and our GPs are working really hard to deliver that, and I think there's going to be some real improvement in that over the next 12 months. All this has been led under the umbrella of the Health and Wellbeing Board, chaired by Councillor Rob Polhill, the leader of Halton Council. I think that in itself is a very powerful statement about the Council's commitment and about Councillor Polhill's personal commitment to improving health in Halton. To have the leader of the Council chairing that very important committee of the Council, but a committee that has on it a whole range of colleagues, because it's not all about clinical intervention. The environment, housing, employment are all very important aspects of helping people to achieve well-being. Good leisure, good recreation, nice parks, good transport, good education, all those things create the opportunity for people to get into employment, take some of that poverty away and give them better opportunity to make different life choices, which will also improve their health and well-being. So we're really about a holistic approach to health improvement and health and well-being in Halton, and the evidence is there that this is happening. I think we're moving into a really, really exciting time where almost we're creating a perfect storm, where I think that we can make a significant difference to health and well-being in Halton. So really, in conclusion, there's plenty to do. Our stats still don't look good, but they are improving, and that's a really good sign. We're moving in the right direction, and everybody is pulling together in the right direction. I think that's really, really important. In conclusion from me, it's really about making that statement, a healthy Halton, a real thing on the ground, and not just a statement in a plan or an action document. We really need to get stuck in now, and I think everybody's up for getting stuck in. So thank you for listening to me, and now's the time to start applauding.